In a first-of-its-kind organ transplant from a dead donor, Iranian surgeons have managed to accomplish an extraordinary feat, saving the lives of several patients, according to a cardiovascular surgeon. Press TV's website has provided an exclusive article in this regard. Stay tuned for more. In an exclusive interview with the Press TV's website, Dr. Zeraatiannejaddavani said through a novel technique performed for the first time in Iran, organs were donated from a deceased person to living persons. The surgical procedure has so far been performed on 3 donors and all the recipients are healthy. Dr. Douani, assistant professor of cardiovascular surgery at Iran University of Medical Sciences, said, however, the results of the transplant have not been officially published in any journal yet. We are waiting to see how recipients' bodies respond to it and how the organ function, he added. The first transplant after an individual's death was carried out 7 months ago, Dr. Douani informed, adding that the CPR, or cardiopulmonary resuscitation, continued for about 60 minutes, but eventually proved unsuccessful. Soon afterward, another patient on the organ transplant waiting list who matched the donor was transferred to the operation theater. The doctor remarked the second attempt was a success. He told the Press TV website, "We successfully managed to transplant a kidney from the completely dead donor to a recipient in the first surgery of its kind." Dr. Douani went on to add that the same scenario played out for the second patient. However, this time, the donor's 2 kidneys and liver were donated to the matching recipients. In the third patient, the lungs, liver, 2 kidneys, and pancreas were all donated, he said, noting that the recipients are all doing well and are in a very good condition. Following correspondence with Donation and Transplantation Institute, DTI Foundation, we were assured that this is the first time such a procedure in organ transplant has been performed in the world, Dr. Douani said, adding, "We conducted research for a year before implementing this technique to decide if it proves viable." Pertinently, DTI brings together medical practitioners from Spain, Europe, and America to advise and support the implementation of projects in organ, tissue, and cell donation. Dr. Douani stressed that one of the important factors in implementing the technique is that the team performing it must be on their toes around the clock, as they don't know when a donor may be available. Organ donation is a life-saving procedure, which according to Dr. Douani is traditionally performed in the world, either after a brain or cardiac death. Brain death is an irreversible condition when all brain activity ceases and therefore the patient cannot regain consciousness or is able to breathe without critical support. A person who is brain dead is legally confirmed diseased, so the organs may be viable for transplant. On the other hand, some may die due to a cardiac stroke, which results from the abrupt loss of heart function, breathing, and consciousness. This condition usually results from a problem with the heart's electrical system, which disrupts the pumping action and stops blood flow to the body. If not treated immediately, it can potentially lead to death. Donation after cardiac death or non-heart beating organ donation, which is also referred to as donation after circulatory death or DCD, is the retrieval of organs for the purpose of transplantation from patients whose death is diagnosed and confirmed using cardiorespiratory criteria. According to Dr. Douani, donation after cardiac death was performed for the first time in the country by his team at Zeraatiannejaddavani General Hospital, which is affiliated with Iran University of Medical Sciences, a premier medical college and hospital. In donation after cardiac death, doctors perform organ-preserving cardiopulmonary resuscitation, OP-CPR, which is defined as the use of CPR in cases of cardiac arrest to preserve organs for transplantation, rather than to revive the patient, he said. After the donor's heart starts to beat again, the patient is transferred to the operating theater, and some drugs to increase the patient's blood pressure are administered, and the process of donating organs in accordance with Health Ministry's guidelines begins, said the surgeon. The technique, Dr. Douani hastened to add, is so far performed in the US, Australia, Spain, as well as Iran. Despite the two aforesaid techniques in donation after complete death, the patient has no blood circulation, heartbeat, or lung function, he remarked. However, there is no difference between the outcome of each of the transplant techniques, the working of the grafts, and the organ's function. All the organs are retrievable in donation after complete death, and it solely depends on the alacrity and experience of the surgical team to harvest as many organs as possible, Dr. Douani stated. Dr. Douani said the new technique, as well as donation after cardiac death, will increase the number of available organs by 20 to 30% for patients on the waiting list whose lives hang on a thread. In the post-COVID-19 era, and with a drop in the number of brain deaths due to decreased road mishaps, this strategy will increase the number of possible donors for the recipients on the waiting list. This is a new window and a new era for the future of organ transplantation in our country, the surgeon said. Many patients die in hospitals daily, so the cause of death does not usually matter, he said, adding that they just need to be there at the right time and manner and based on protocols and contraindications. However, the doctor added it is best to choose patients who die at the hospital and are in the vicinity of an operating theater. Dr. Douani stressed this way donors can be transferred to the operation room as soon as the relatives sign the consent forms. While this technique of donation after complete death has so far been performed at Tehran's Zeraatiannejaddavani General Hospital, Douani said it is possible to use this procedure in all provinces across Iran. He added, surgical teams in other provinces just need to familiarize themselves with the technique as well as learn how to persuade the donors' families to donate their patients' organs. He said that talks are underway with the Ministry of Health to expand the program to other provinces and hospitals in the capital, Tehran, saying, we already have the necessary infrastructure and technology in order to perform such a procedure in other hospitals, at least in the capital.
Joining us now from Ontario, Canada.
Now back to our story.
What is it in there?
We will be talking about this.
Let me bring in Leo Sazdi. He's a professor of international.
The Spotlight.
News in the Ukraine war is not so much about advancements on the ground as they are about military assistance to Ukraine and Zelensky's guest appearances, like his most recent visit to the UK, then the Elysee Palace in France, and then the EU capital in Brussels, all in the span of a few days. His request, more aid and military equipment, in particular fighter jets. No surprise there. Will he get it? How much aid does he want? How many more requests and how much longer? Will Russia tolerate the pumping of military equipment to Ukraine while all leaders of the Western world have said we are with you, Ukraine, till the end? First, let me introduce our guest for this edition of the Spotlight. Andrzej Drobniansky, Chair of the UN Affairs, the Ukrainian World Congress, joins us from New York. Dr. Tony Schneider, who's at the Schiller Institute in Germany. We join us from Potsdam. Welcome to both Dr. Schneider. Let me start with you first. We're taking a look at the communities that Zelensky has made this kind of days of us in the intro. Looking at the date, the guests in the parliament there, the moving on to the Elysee Palace, the president of the chancellor there, and of course the EU. Why do you think Zelensky has to make these appearances in the first place? And I must add in the Oscars, Wall Street Bells when they open up, and other appearances where he has been appearing via live video stream, which in this case he didn't do in the past 3 appearances. What do you make of these appearances in the way that he has made them?
Well, I think he's in trouble. He's in trouble in Ukraine. He's reshuffling his government. The corruption charges are starting to have some real traction. And the military has been badly damaged by the war. They're running short of ammunition. They're running short of soldiers. And the Russians are preparing